already created a life with this baby. Number one is a threatened miscarriage. And a threatened miscarriage where this is a uterine pregnancy, so the fetus is in the uterus, and there is a healthy, strong cardiac activity, which means there's a good heartbeat, and the cervix is closed. And actually, these types of miscarriages, 90 to 96% of them do not miscarry. And these often go on to be healthy deliveries. So 90 to 96%. Also in a threatened miscarriage, the bleeding tends to happen between 7 and 11 weeks. So very much first trimester. Number two is called an inevitable miscarriage. And this is when the cervix is open, there's contractions, there's bleeding, and usually shortly after, tissue passes through. And sometimes in these miscarriages, medical or surgical intervention is needed to complete the miscarriage, to complete the expulsion of the tissue, because you want it to be fully complete. You don't want to leave anything in your uterus. So occasionally, if tissue is not expelled out, all of it, they may need to use medicine such as methotrexate or surgical means to ensure that everything's been expelled out of the vagina and out of the uterus. Number three is called a complete miscarriage. And in a complete miscarriage, this often happens before the 12-week mark. And in this case, it's called complete because the entire uterus expels everything out. So the tissue, the fetus, everything is expelled out, and hence it's called a complete miscarriage. With this miscarriage, often small amount of bleeding occurs and very mild cramping, or if even cramping occurs. So with this type of miscarriage, there's actually a small amount of bleeding and a very mild amount of cramping that occurs. Number three is called an incomplete miscarriage. And this is when the membranes rupture and some of the tissue has expelled out. However, there are still large amounts of tissue and whatnot left inside of the uterus, and further measures need to be taken in order that everything is expelled out of the uterus. An incomplete miscarriage is mostly common at the end of first trimester or the beginning of second trimester. Also, in this type of miscarriage, there's often some bleeding as well as cramping, but an ultrasound will also indicate that there is tissue and possibly parts of placenta left within the uterus, and hence why medical or surgical procedure or intervention is required to ensure that everything is expelled, and so the mother is safe from potential infections or other dangers involved with leaving tissues or placenta in the uterus. The last one is a missed abortion, and this occurs prior to 20 weeks, and it is the death of the fetus within the uterus, but retention of the pregnancy for a longer period of time. Women often complain about not feeling pregnant anymore. For example, they may not have breast tenderness, they may not be nauseous anymore, and this most definitely requires surgical or medical intervention to ensure that everything within the uterus has been expelled for the safety of the mother. An ultrasound will often indicate there is a fetus in the uterus, but there is no fetal cardiac activity. So that basically wraps up the 4 main types of miscarriages pregnant women may experience, and this is a really difficult topic. And the reason I chose to do it is because I think it's the least understood topic amongst pregnant women, because we're so desperate when we see bleeding that we will read information everywhere on the internet, even non-reputable sources, because we want to read what we want to read. We want to read that this is not a miscarriage. We are looking for answers in places that are not accurate and not correct. And I did this video because I remember feeling this way and not having anywhere to look to in terms of appropriate information. So I promised myself I would make this video in the future to help other women who may be experiencing this fear or going through bleeding or anything similar to this. And if you have had a miscarriage, or if you think you're going through one, or whatever it may be, remember tell your physician, go to your physician, go to the hospital, whatever you need to do to ensure your safety as well as the baby's safety. And most importantly, if you've gone through a miscarriage, simply going to a grief counselor. This is important to mentally take care of yourself if this has occurred to you, because it is beyond hurtful having a miscarriage, because you've envisioned a life with you and the baby and your partner and family. As soon as you get that pregnancy test, as soon as you get that positive, you've created a life with that baby. Even on day one of getting that pregnancy test, you've envisioned this baby, you've made plans with this baby, you've already created a life with this baby as soon as you get that positive pregnancy test. And to have it all taken away is beyond words. So please take care of yourself physically, mentally, emotionally. Talk to someone, talk to family, talk to a friend, talk to a counselor, because this is something that needs to be discussed, and you need to really take care of yourself. And I really hope that I was able to describe the 4 types of miscarriage and hopefully bring some awareness to women out there who might be going through this. Anyways, I'm wishing everyone a happy, healthy pregnancy with no problems, no issues, and most importantly, no bleeding. Have a good night.